Welcome to our deep dive on neuropathic pain. This video will explain what it is, why it behaves differently, and the core strategies for effective treatment. Neuropathic pain is pain caused by a lesion or disease of the somatosensory nervous system. It is not just more pain, it's abnormal sensory processing. Unlike regular pain, which signals injury, neuropathic pain arises from damage within the nerve pathways themselves, leading to erratic and often debilitating signals. This condition often presents with a mix of symptoms, including positive symptoms like burning and electric shocks, and negative symptoms like numbness or weakness. This mixture indicates both abnormal signaling and partial loss of normal nerve function. Understanding neuropathic pain requires looking at two key components, the peripheral generator and the central amplifier. The peripheral generator is where injured nerve endings or axons become, "noisy." Changes in ion channels cause ectopic discharges, meaning the injured fibers fire spontaneously. The central amplifier involves the spinal cord and brain. Persistent peripheral input activates pathways, and immune cells turn up the pain signal, meaning that even briefly numbing the injury site won't stop the pain. Think of a peripheral nerve not just as a wire, but as a living cable, with four vulnerable metabolic systems. First, the axon and mitochondria. Axons are long and energy-hungry. Any hit to energy supply can cause degeneration, often seen in conditions like diabetes. Second is myelin. Myelin insulates the nerve, preventing crosstalk. Demyelination slows conduction, causes abnormal impulse crosstalk, and leads to spontaneous firing. Third, neuroinflammation. Even non-autoimmune neuropathies can become inflammatory. Immune signaling can sensitize pain receptors and amplify central pain signals. Finally, microcirculation. Nerves have tiny blood vessels, and ischemia, or lack of blood flow, can cause hypoxia, which directly injures the axon. This is common in diabetes and smoking. Effective treatment for neuropathic pain is a two-track approach, managing symptoms while focusing on nerve repair and addressing the root cause. Traditional painkillers often miss the underlying biology. They don't fix the nerve generator and can, in the case of opioids, lead to tolerance or increased sensitivity to pain over time. The first track is symptom control, calming down the nerve excitability and reducing central amplification to provide immediate relief. The second and critical track is repair and driver reversal, restoring nerve health and addressing the root cause of the injury signal. Before escalating pain medication, clinicians classify the pain by its underlying driver. This driver-first logic guides the most effective long-term treatment. Autoimmune or inflammatory drivers often present with asymmetry and high inflammatory markers. Treatment focuses on immunotherapy and neuroprotective support. For degenerative or compressive drivers, like radiculopathy or carpal tunnel, the mechanism is mechanical injury and ischemia. Treatment often involves physical therapy, decompression, and posture adjustments. Metabolic drivers include conditions like B12 deficiency and diabetes. The mechanism is mitochondrial dysfunction and oxidative stress. Treatment requires correcting deficiencies and managing the metabolic disease. In conclusion, achieving lasting relief from neuropathic pain means going beyond just masking symptoms. The most successful strategy focuses on identifying and reversing the underlying biological driver to truly restore nerve health.